Hey everyone, this is Kieran. Today's exercise is looking at how to further strengthen our subscapularis along with some other internal rotator muscles of the shoulder. So internal rotation being the ability for your arm to get into these types of positions and behind your back. So if you feel like that's something you've struggled with and you've worked through some exercises and you're ready for some progressions, then this will be a nice exercise for you. Hopefully you've watched some of my other videos on internal rotation, but basically with internal rotation we've got a handful of muscles that can do that job. Now the subscapularis is a muscle that primarily does just that, along with some other movements of the shoulder joint. But we have a couple tests in our profession that can be really useful. Now, as a little bit of a sort of update on some of the research, a lot of our special tests for the shoulder, the tests that physios would use or specialist doctors, unfortunately they're not quite as specific as we hoped they'd be. But that specificity doesn't necessarily mean, which we've learned, that it's going to be helpful in making the shoulder situation better either. So it's like this situation where we thought these tests would be super helpful to have that information. We found out that those tests didn't necessarily give us that information. And then we found out that knowing that information wouldn't necessarily be helpful anyway. So, you know, sometimes you go down paths of inquiry and you end up in a dead end, but knowing that that's a dead end is a good thing. This particular scenario though, with the shoulder, is this test here. If I can lift, so someone would lift that hand off your back like this, and then can you hold it there? So they take their support away and can you hold your arm there? Now if you can't hold your arm there and this pain isn't a limiting factor, you just feel like there's no strength or power, then you might have injured the subscap muscle. Now it's a probability thing, so the chances are you have, it's not a guaranteed. So you might do that test and then you might, okay, I think this is really, really weak. And then maybe you get some imaging to confirm that if you think it's a big tear. Now, the degree of that is hard to know with the testing. You can't really say the degree of it. So one of the ways that you can figure it out though is if you do some of these exercises, probably not this one to start with, but some of our other ones, which I'll link up here, and you start to see some improvement, and you know that the muscle's intact, along with some of the other muscles that might help with the movement. And then you can kind of go down that path of progression and not necessarily need further imaging because you're making progress anyway. So knowing whether or not, you know, if the degree of the tear is useful is kind of an interesting discussion. Now, if you're younger, you might need that information because maybe your sport would require a fully intact tendon and you have to think about what that would mean. Versus if you're older, chances are you're going to have a tear anyway, and that's normal. It's almost like an age-related change now, particularly for males, and every decade you get older, the chances of finding a tear in there is very high. But a lot of people have no symptoms. So just some, I guess, information and understanding around what we find to be normal in a shoulder, and particularly around what age you are, and then considering those things when you're deciding around how to manage it. But in this case, like I said, this test can be useful in telling us if there is or isn't maybe an injury to the muscle, and then that can help guide our prescription and our management. But it doesn't necessarily tell us how severe the issue is, but it's still useful for prescribing exercise, right? So the exercise that we're going to do is influenced heavily and based off of this test. But again, if you're just starting out, check out some of our other Subscap videos, which I'll link again, and they're a bit of an easier start, okay? So with this exercise, I'd say a precursor is that you've regained the ability that if someone does that test, they lift your arm away, and then you try and hold it there yourself, you can hold it there. If you can't do that, then you won't necessarily be able to do this exercise. That being said, for someone that doesn't have a large injury to this muscle and it's more pain inhibition, you might find that doing this exercise helps you regain that ability. So see if you can do it, and then if you can do it, you do what's tolerable, so don't flare symptoms up. But if you can't do it and there's no strength and no power, then obviously see your local health professional and just check in with what's going on and get some specific exercises based on a specific assessment that you've had. That'll be a little more appropriate, okay? So how do we set up? Hand's gonna go behind the back. It could be down on the tailbone area, or it could be a little bit higher. Just see what feels challenging enough. It has to feel like medium difficulty. And you're gonna put your hand on the wall. I'm gonna put my other hand back here as well. And then all I'm gonna do is push myself away from the wall. And so by pushing, I'm creating that internal rotation. Now I'm doing two hands to start, and then eventually you can move towards one hand. So if I go onto the right arm, and one hand there, right? If I go left hand, and I've had a left shoulder injury in the past, let's see if this one's a little bit harder. And yeah, it just feels more effortful. I can still do it, but I know that there's a little bit of difficulty there. So I might find benefit from doing this exercise a little bit. What would be the benefit though? Do I do a lot of things needing power in this direction? Not necessarily. I have enough flexibility. The left side's maybe a little bit tighter. It's my non-dominant side. So just weighing up time spent doing something versus the benefits from it. How do you progress this or make it easier? Depends how far away from the wall you are. If I stand really close to the wall, then when I push, it's not going to take me far to push myself to tip over, right? If I bring my feet further forward, so now I'm leaning into the wall like this, that's going to be a much harder thing to do because there's more weight going backwards, and that muscle has to be able to push myself away. All right? You could do two hands, so it's like a little bit of assistance from the other side, but super straightforward exercise, really minimal need of equipment, and a nice way to just start improving your ability to get back here and develop some of that strength so you can kind of get into those back pocket areas or, you know, reach behind in a car, for example. Okay? Super simple exercise. Really, really recommend it as part of a subscapularis rehab program or any sort of rotator cuff issue or even like a shoulder rehab in general, just to regain that ability. If you've got any questions, please ask in the comments. And if you haven't, again, watch those other Subscap videos. You get a lot of good information in there if you're just starting out. If you like this video, then please hit like below. Otherwise, to check out more of our content in the future, you can subscribe to our channel by clicking our logo over here. And to check out our latest video, click up here.